So I thank you so much. I invite Rachel Carafello for the next talk. To what extent do patient demographics, clinical characteristics, and psychological factors explain quality of life in vitiligo?
Good morning, everyone. I just want to say how much of an honor it is to be here and to present my research here with you guys. So with that, I'll begin. My name is Rachel Carafello, and I've just completed my master's in health psychology from King's College, London. And my dissertation focused on vitiligo and quality of life. So more specifically, to find out to what extent do clinical characteristics, patient demographics, and psychological factors explain quality of life in vitiligo. My supervisors were Professor John Weinman, Dr. Mark Turner, and Dr. John Ferguson. So as Dr. Azzedine just described, low quality of life is prevalent with vitiligo and considerable variation across individuals. And it has been compared to other dermatological conditions like eczema and psoriasis. It's been found to be related to patient demographics, clinical vitiligo characteristics, stigma, so the perceived and internalized level of stigma related to their patient's chronic vitiligo, and illness perceptions, which can be defined as how an individual experiences and mentally frames living with a disease, specifically the vitiligo, and anxiety and depression. However, it has not yet been established to what extent each of these factors account for quality of life in patients. So our study objectives were to better understand these factors which affect quality of life and to examine the correlation between the factors and also more specifically to discover to what extent each of these factors influences quality of life. Clinical factors can be defined as the severity of vitiligo, the noticeability, and the type of vitiligo. Demographic can be defined as age, gender, and ethnicity. And psychological are the stigma, the illness perceptions, anxiety, and depression. So our study was a cross-sectional study with 156 patients with vitiligo from the vitiligo clinic at Guy's Hospital in London. 48.1% were female. The ages ranged from 18 to 79, with the mean age being 43 years old. And we measured the psychological factors with these 4 questionnaires, and patients filled them out on their phone prior to going into the clinic. This was the brief illness perception questionnaire, the stigma scale for chronic illnesses, and the generalized anxiety disorder assessment, and lastly, the patient health questionnaire for depressive symptoms. The stigma scale for chronic illnesses is an 8-item short questionnaire that is a self-report, and it's newer, so it's quite interesting to see the results that we've gotten from using this questionnaire. To measure the clinical characteristics, we use the vitiligo noticeability scale, which is a subjective self-reported scale from patients, as well as a vitiligo extent scale, which was recorded by the physician, Dr. Ferguson, in the clinic. Lastly, to measure quality of life, we use both the Dermatology Life Quality Index and the Vitiligo Impact Patient Scale. We use both of these because the Dermatology Life Quality Index is not specific to vitiligo, and it doesn't necessarily show how it can impact specifically this patient population. To analyze the data, we used Pearson's correlation coefficients and 2 hierarchical regressions for each of the different measures of quality of life. So here you can just see the ethnicity and the Fitzpatrick skin phototype on the right. Majority of the patient population was Asian, followed by white, and then Afro-Caribbean. And here you can see the Fitzpatrick skin phototype scale going from 1 to 6, with 5 being the most prevalent. Here we have the breakdown of the types of vitiligo that patients reported. So we have the generalized, acrofacial, and the focal being the most prevalent out of this sample. Here we have the DLQI breakdown, showing that above a third, just over a third of the sample was experiencing moderate to extremely large impaired quality of life, which is really important to note and is comparable to other studies that we have seen. Here we have the VIPS scores. So again, you can see that as it goes higher, we have moderate to severe impaired quality of life in this patient population. So here you can see the correlations between the clinical characteristics in the two measures. We see that the vitiligo extent score and the vitiligo noticeability score both showed significant correlation with the VIPS. And this is important to note because this can show you how maybe the VIPS is more accurate with showing the correlation between extent and impaired quality of life than the DLQI. Here we have the socio-demographic factors and the two measures. It's interesting to note because nothing was significant here from this study, whereas in other previous studies, this has been quite prevalent and significant. So that's just important to note and interesting. And here we have the breakdown of anxiety and depression data that we got from this sample. So you can see that majority had minimal, but there is about almost 25% of patients are experiencing higher to severe anxiety and mild to severe depression, which is really important to note and to look at. Here we have the stigma results. So we have a little under 25% experiencing high levels of perceived stigma, which is really important to note and really interesting to understand what patients are experiencing. Even if it's not the majority, there are patients that are experiencing high levels of stigmatization with their vitiligo. And lastly, with the psychological measures and the two different quality of life measures, we see that there are significant correlations between anxiety, depression, stigma, and illness perceptions, which is are all strongly associated with quality of life. The two regressions that we did for the DLQI and the VIPS show that once we put all the factors in, psychological factors showed the greatest increase in explained variance for quality of life over and beyond patient demographics and clinical vitiligo characteristics. Some limitations of this study are that it's a small sample size and it's from a specialized clinic in London. But what we found is very important to note that psychological factors are explaining greater and more significant variance in quality of life over and beyond patient demographics and vitiligo clinical characteristics. Going forward, the data suggests that the multidisciplinary treatment of vitiligo, addressing both psychological and physical factors, may achieve better quality of life outcomes for patients. And Professor Weinman is actually working on creating an acceptance and commitment therapy geared towards stigma and illness perceptions for this patient population, and hoping for better quality of life for vitiligo patients. Thank you for listening.
Thank you.